We were looking at the overuse of social work and sort of disproportionate people on waiting lists for things which they didn't really need.
We needed to look at a different way of getting to the public, enabling the public to take control for themselves.
Quite often the support that people require most could be provided by a community group, a voluntary group or somewhere else in the community. It doesn't have to be statutory services such as social work or an OT. Talking Points in East Renfrewshire have been designed to be accessible to the community as possible. So we've selected places which are at the heart of those communities. Staff are drawn across some services from the statutory sector and from the voluntary and community sector. And at Talking Points, there's an opportunity for local people to come in and ask anything about health and social care.
Community-led support started in Hawick about 2 years ago now, I think, and we did start up in a different location at Burnfoot, where we thought would be a perfect place for us. It had good parking, good access. However, a few months into it, we kind of realised that we weren't getting the footfall up there, so we made the decision to move down into the town centre to the heart of Hawick, which has been absolutely brilliant for us. We've not looked back. The Heart of Hawick is a cafe just in the centre of the town. It is got a cinema built into it, and it's not as daunting for them as going into a council office.
It's not branded with the NHS, it's not branded with the local authority, it's actually not even branded with our own name, and people do feel comfortable to come through the door, have a conversation about anything that's going on.
We do the drop-in clinic at Soup and a Chat, and it's volunteers who run that, and that's for people maybe with mental health issues, addictions. Social work ourselves are there, Seascape, the food bank's in there as well, so it's just a good place for people to come informally, meet, get a bit of information and advice there.
So they play quite an important role of getting people through the door, which is why we've linked in with that.
It's kind of like a one-stop shop, I guess. Everybody, you can access a lot of services just from here. I think people like that instead of being sent here, there and everywhere for all different things.
I've been running Good Conversations workshops for a couple of years now, and I think they're really important. Initially, we use this as an approach to to get buy-in to the community-led support approach. So we had librarians next to pharmacists, next to OTs and support work staff, and that was really good because when we used the resource wheel in that experience, it was an opportunity not only for people to find out what each other did, but also what was around in the community. It was an opportunity for cross fertilise all the learning.
For people coming to the hubs, hopefully they feel that they're able to lead the conversation and have a broader conversation about all the different things that are happening in their lives, rather than feeling they have to wait to be assessed.
It was really important that the third sector was one of the partners around the table.
We use our third sector a lot. We've done a lot of work to bring them on board.
We very much work in partnership. It's a case that we all work together. It's really, really good, and I think the more that we share information, that's what makes it a success, really.
Once I found out all about community-led support, particularly the new front doors, new style of working, but most importantly it being person-centred, I really believed, and I do believe, that it is the way forward.
The assessment tool that we use here, the What Matters assessment, is a 4-page document. The What Matters tool enables us to listen effectively and converse effectively with the person. So it's almost about looking at what are their strengths rather than looking at the deficits all the time. Deficits change the conversation completely. Strengths empower a person.
You're actually getting to sit in the community and work within the community, so it's a very positive and enjoyable experience.
I think it's breaking down barriers a wee bit as well. With social work, people are starting to see now, and they're more comfortable coming to us and approaching us.
Yes, they'll come up and ask us anything.
I think community-led support's been a great thing, not just for Hawick, for the whole of the borders, and people are finding the services a lot more accessible. Our waiting lists have changed dramatically since we've started doing the hubs, within the town.
It's supporting people to really feel like they're part of a team, and this is an opportunity where people can really say what's important to them when they're doing their work.
We have a much clearer understanding of who's delivering what across East Wren. Through the focus of talking points, we're able to kind of pinpoint it a wee bit more.
It has made social work and other organisations aware of a lot more of what's out there in the community.
You're talking more, you're networking more, and the opportunities for people out there is actually vast.
I think my staff feel more appreciated by the social workers that they work with. Our role is recognised more as being valuable. And I think we've got a much more professional footing, if you will. I think we're treated as being a professional organisation that can work alongside social workers, OTs, nurses, etc. to a standard that they would expect of fellow professionals, and I have to say vice versa.
It's the best thing I've ever done in social work for a very, very long time. You get bogged down in crisis and critical need, and yet all those things still happen. But there's lots of good things about social work, and this is one of them.
This is going back to what it was. It's rooted in the community. Don't call it a project, don't even call it a programme. It's really a principle-based or values-based approach to cultural change.
Please ensure that the third sector are a strong partner from the beginning, because together we can really make it work.
It's been a real learning curve for us.
It's slow to start because people aren't sure of it, but definitely embraced it.
It's in the name, it's community-led, so listen to the community, what they want you to do.
The community will always lead you to the right place. Be open.
It's about not being afraid to try it.
If you're not busy or if it's not working in a certain venue, then don't be scared to move.
Using this system, this way of working, it is the best day of my working week by a country mile.